Hello, good evening everyone. Today we are going to talk about COPD. COPD means chronic obstructive airway disease. The month of November is being marked as the COPD month, with the 18th of November being marked as the World COPD Day. Now you might think, why so much importance is being given to this disease? This is actually a very common disease and it is increasing by the day. It has already gone from being the sixth largest killer to being the third largest killer. Traditionally, we would think about COPD as the smoker's lung disease, and it was limited to people who would smoke for long and who were prone for this disease. But I think all of you will agree with me. Now, all of us are exposed to so much pollution. The pollution levels are zooming up, which again exposes our lungs, and the prevalence of COPD is increasing by the day. So I think we are moving away from COPD being predominantly a smoker's lung disease to a disease that we are seeing now in everyone. We are also seeing COPD or the obstructive airway disease in a much younger population. Now the main symptoms that might be for COPD will be shortness of breath. This would normally, now there are many other diseases which can also cause shortness of breath, but in terms of COPD you would see this in later years. You would starting from late middle age to elderly people, and you would have history of smoking or exposure to pollution, and you would have shortness of breath which will be chronic and it will be persistent, very different from the ones they have in asthma, where the shortness of breath is periodic or episodic. So it's not difficult to make out a patient of COPD. It's in fact very easy from a simple clinical history and a simple lung function test. In a lung function test, we basically ask the patient to blow into a machine which tells us about the blowing capacity or the obstruction to that blowing capacity, which helps us make a judgment about the possibility and the severity of the disease of COPD. Traditionally, the patients would also complain of having excessive expectoration, and COPD may start with the lungs, but it will eventually involve other parts of the body. It will have a strong impact on the muscle bone mass and also on the mental and the social aspects of life. So it's a very debilitating disease and it sort of progresses over the years, even after you've given up smoking. And the sort of the help that is needed to deal with this keeps on increasing because you are eventually short of breath and your life is limited to a few steps and eventually you're bed bound. So it is a very resource intense disease. It is one of the leading cause of hospitalization throughout the world. And patients of COPD will just keep bouncing in and out of the hospital. So it is very draining on the finances. Your ability to work decreases. So I think it's time to think about how can we deal with this disease. Of course, the most important thing is the cessation of tobacco smoking, which is the most preventable cause of disease in disease and death in the world. Every effort should be made, I think, now that we know so much about tobacco smoking and its ill impacts, that we should now think about the giving up smoking at the first instant. I think at every possible interaction that one has with a smoker. I think the other major issue that I think we are facing is the issue of pollution. At an individual level, I'm not sure how much we can really do, but I think as a society, as a community, it is a great point to help us work towards a consensus to build systems around where we can deal with this at a community level, and of course at an individual level. Whatever we can do, limit our outdoor activities, monitor the pollution levels, make sure that the indoor home environment is good enough that we are sort of protected to a large extent. I think we've got, at least with this ongoing pandemic, used to wearing masks, which can also protect us against the ill effects of pollution. So and if the disease does happen, I think it is important to be diagnosed early, and it's important that we start the treatment. And one of the things that we see very commonly is the patients sort of resistant to using the medications, which is often the inhalers. So I think it's a very bad combination when you have bad COPD and also the mental resistance to use inhalers, which are the mainstay of treatment for these diseases. We've come a long way in terms of developing new inhalers, new sort of treatments, and we have a newer combination of drugs in these inhaled medications, which have helped the COPD patients in a long way. So we have made, I think, many advances in the disease, but it is a disease I think we still are learning every day about. But we don't even have a Hindi sort of name for the disease. That also tells us the low level of awareness about this disease and how much work is needed for us to increase the awareness on this the aspect of disease and amongst both the general public and the general physicians. The themes this year, I think, was to work at multiple levels for these COPD patients. One was to also look at the increased recognition of the disease, to work on the emotional and the mental well-being. Often when we see patients of COPD, we are focused on the airway disease, their lung function, how to optimize it, but we often miss out on the impact on the social and the mental well-being. So this year I think there's a lot of impact on that. It's also important to help the patient self-manage the disease, have the patients have a self-management plan. It is a chronic disease, it's not going to go away, it is going to only often get worse over a period of time. So it's important to make patient be part of the treatment plan. They're aware of all these modalities of treatment. It's important to emphasize the need for physical exercise. So this is and pulmonary rehabilitation, which is the cornerstone of management of COPD. So those are the things that have been emphasized this year to bring about. We have all especially in the national capital region of Delhi, facing a lot of pollution. This is likely to be very harmful for existing patients of COPD and the patients who are vulnerable to have the disease. Every caution should be taken by these patients. So it's important that I think at all community levels, at all medical levels, all fraternities, platforms, that we talk about this disease, which is increasingly getting common, which is going to kill a lot of patients in the next few decades. With this, I conclude my message for the COPD. Thanks.